Well, there's a groundbreaking decision here in New York City. The Board of Health voting to change the way menus at restaurants look. A symbol will now appear next to the dishes with more than the recommended daily amount of sodium. Public health advocates have been pushing for this change, but of course the idea does have its critics. Laura Ingle joins us now with more on this. So Laura, first it was the calorie count, then you can't drink the big gulp thanks to Mayor Bloomberg, but now salt.
Well, they just want you to be warned, forewarned before you have that meal. The unanimous vote took place just a few minutes ago. The New York City Board of Health passing a rule that will force chain restaurants, which is about 3,000 out of the roughly 24,000 restaurants in New York City, to show us the sodium when ordering our food. New Yorkers have already been encouraged, as you mentioned, Eric, to eat healthier, to curb consumption of trans fats, large sugary drinks, and starting in December, they will be learning more about how much salt they are about to chow down on. The vote will force about 3,000 restaurants to put a black and white salt shaker emblem on the menu next to dishes that have more than 2,300 milligrams of sodium. That's about a teaspoon. This makes the Big Apple the first U.S. city with this type of requirement, something that critics say is not the right way to try to limit sodium intake. The president of the Salt Institute, a trade association for salt producers, issued a statement to Fox. It reads, "This is another example of the government creating policy based on outdated, incorrect sodium guidelines that have been refuted by 10 years of research. Research shows Americans already eat within the safe range of sodium consumption, and population-wide sodium restriction strategies are unnecessary and could actually be harmful." Now, the New York City Department of Health commissioner says this is a way of letting consumers know about foods that could raise the risk of high blood pressure, potential heart attacks, and strokes.
This really represents to me the next step in allowing usable information for our community to make better health decisions. And the evidence also shows that even though calorie and salt nutritional information is available in chains, the rate of people actually accessing that information is exceedingly low.
And some restaurant owners have said eating healthy initiatives should focus on a diet as a whole, not a particular ingredient or food. And the city should leave salt warnings to the feds. Eric?
All right. Well, some doctors have been warning about the level of our sodium, so we'll see how this goes.
We'll see how it goes.
All right.